My name is Dasha Saian Marchese. I'm the CEO of Saian Skincare. And today, I would love to show you a simple facial cupping routine. Now, you may have heard about cupping, and you may be curious, how to do cupping on the face? Does it leave circles? Well, we'll talk about that. The different types of cupping are static and dynamic. Static cupping is an integral part of traditional Chinese medicine. You may recognize this type of cupping from photographs where you can clearly see circles on the patient's back. This is from suction, either from suction using a type of gun mechanism with the cups, or from fire cupping, which involves taking a cup and inserting a lit piece of gauze that's soaked in a little bit of flammable liquid. It heats up the inside of the cup, and then the practitioner very quickly puts it on the back of the patient, and that heat effectively pulls the flesh inside of the cup, creating a vacuum. Now, this vacuum is going to essentially lift up some of the stagnant blood in the body into that cup. And that's what you see. You see a very dark purple circle on the patient's back. Now, this is said to move your circulation and to move all the stagnant blood to the surface. Now, this is not what we will be doing today. We will actually be doing a dynamic cupping for the face, which is different. Now, our purpose here is to move the lymph, it's to depuff the face, to plump all the little lines and wrinkles, and to rejuvenate the appearance. Now, our dynamic cupping involves constantly moving, sliding the cups. So you will never have an instance where you have bruising on the skin. You have to learn how to do this swiftly enough so you don't leave any marks on the skin, and we can learn that together today. Before we get into our actual cupping portion, I do want to show that we're working on completely clean skin. In my facial, I'm going to go through all the steps such as cleansing, exfoliation, extraction, and when I get to the massage portion, I'm going to do my cupping. Now, this can be done in addition to other types of massages, such as gua sha or your regular type of European massage, or you could just do the cupping. And it's a wonderful treatment for your clients, especially those with youthful complexion, younger clients that don't have any broken capillaries. You don't want to work on somebody who is on blood thinner, who has very thin skin, couperose. Those would be your contraindications for the cupping. I also don't like to perform the cupping after steaming the face because that may cause a little bit more redness. You don't want to aggravate the capillaries with a lot of heat and then the pulling from the cups. So you want to do more of a warm towel to prep the client with your enzyme before you start the cupping. Before we start the cupping portion, I would like to show you how to do a fascia release with our cupping ball. I'll show you the types of cups that I'm using today. Now, this type of cup has a glass portion and a bowl. You may have a different type of cupping set, which involves a cone-like silicone cup, which also work great. I like these just because of this ball here, and I'll show you how to use it. It gives me a lot to play with here with my fascia release. So I love these, and you see how I'm using them. Now, before I apply any oil to the client's face, I would like to show you this release technique. To use your ball, you want to separate the glass portion of the cup from the ball. It's very easy, you just pull them apart. I actually like to do this before I start my cupping, so I mentally know not to apply oil to the client's face. When I see this separate cup, I know that I need to start with the dry myofascial release first. We're going to start by working behind the ear here with our cup. Now you want to position the cup right here, right behind the jaw, and just do 10 pumping, kneading movements here, which will help relax our client and prepare for our lymphatic drainage. So you're going to go in a very steady rhythm, and the pressure will be firm. There you go. Now moving on, we're going to get in here inside the masseter to really relax the client's jaw. Now what we have here is a very busy bone and muscle structure because we talk and we chew, and our masseter gets used all the time, all day long. And a lot of our clients have TMJ. Now, when we do this kneading with a ball, it actually sends a signal to the brain to relax, unclench that muscle. And a lot of clients tend to tell me that this is just what they need to relax their face in preparation for the cupping. Next, we're gonna go right here into our nasolabial lines and pump. Now here, you don't have to apply as much pressure, just gentle kneading. I'm using only one ball with my right hand. I find the control that I have with my right hand with cupping is something that I value more than doing a faster treatment. Sometimes you will see cupping being done with both hands, one on the right side of the face, one on the left side of the face. I actually tend to prefer just working with my right hand here. And now the last step is our temple before we proceed to the forehead. Okay, here on the forehead, we're going to focus more between the eyes on the procerus here, and you want to roll the ball up in circles in a kneading way. This is the favorite part of the fascia release for all the clients. If you want, you don't have to limit it to just that area. You can do the whole frontalis. You may also purchase a ball separately just to do this type of fascia release. I find that having it included in my cup set saves a little money, and I don't have to buy any other type of equipment here. And let's go ahead and proceed doing the same pattern that we did already on this side, on the other side of the face. So now that we've done that portion, we can apply oil. You can choose whichever oil you like to work with, rose hip seed oil, or if you have any kind of blend that you like. I actually like my pure squalene. This is what I will be applying today. You want the oil to be gentle to provide enough slip. If you like a cream, you may do that as well. A good fatty massage cream, right? So we will start by applying the oil to the neck, because we definitely will be draining that lymph onto the neck. And as I'm applying my oil, I want to also provide a nice massage, right? So we're not just applying it, but we are applying it with intention. As I said earlier in today's video, the last thing you want to do is keep the cup on too long because the suction can form a bruise. So I feel most comfortable using my right hand. That way I can adequately control the speed, the pressure, and then release. Okay? So now that we have oil on the face, we're going to start our cupping. And I'd like to start by holding tight the skin on the other side. This also depends on your client's skin. If you have an older client, you may want to do this if there are too many wrinkles and you want to make sure you hold the skin tight. Now, for a younger client, you may not always need to do that, but it gives you a good foundation and makes you very steady while working with the cups, which is what we want because you don't want to keep the cup on for too long. So you want to make sure all of your movements have intention. So let's anchor our hand. I'm going to anchor it on the chin of my client and gently suction my cup here at the top. If you have your cone-like silicone cups, you will suction them as well. And now that the skin, the flesh is grabbed by the cup, you can begin your movements. We don't want to do more than 3 movements per area. All of our movements are going to be towards the ear. Now you just need to suction the cup and it releases itself kind of towards the end once you pull off the skin. I want you to notice the size of the cup that I'm using. I'm using the larger cup. This one is 25 millimeters. You definitely want to use a larger cup for the face, lower face, and the smaller cup for the forehead where we don't have that much flesh. Okay, now that we've done the lower portion of the face, I'm actually going to go down the anterior portion of the neck here to help with our lymphatic drainage. So what we can do is we can turn the client's head a little bit to the side here and do some nice movements here. And we will come back that way, but in the posterior in just a second. So just a few. We are not going to touch the front of the neck where we have our thyroid. Just do the front portion of the neck on the side. Now let's do the other side of the face while we have our larger cup. As I was saying, I like to use my right hand, and the client definitely doesn't see me working with my left hand, my right hand. So there's no reason to switch your hands if you're not confident with your left hand. Now that we've finished the lower portion of the face and neck, I would like to switch to another cup size. Now this is a smaller one for working closely around the eyes and the forehead. Since our forehead doesn't have as much flesh as the lower part of the face, we do need to use a smaller cup. So we're going to do a little bit of movement upwards, and then we're going to work with our cup to push everything towards the temple here. So do a few up with your cup in the same way that we did the lower portion of the face. You're actually going to be suctioning in a little bit as you start the movement and then releasing the cup as you get to the top of the forehead. You want to work upward on the frontalis. And now we're going to do the same, but sideways towards the temple. We're going to start in the middle and work down towards the temple. Now you'll need to do about 3 to 5 passes here. And this feels amazing. It does relax the forehead, especially if your client tends to frown a lot. This is a really good reminder to, again, as I said, unclench your jaw in the lower part of the face and relax your forehead when it comes to doing the top of the face. Here we're going to work a little bit on our crow's feet, just suctioning in and pulling. And remember to keep moving your cup and always have enough oil. Always have enough oil, which will help the glide and provide comfort for the client. Now, the last thing that I want to do is take my larger cup and just follow through with the posterior neck here to try to really finish off the treatment with a good drain. We already worked on the anterior, and now we're just finishing off here by guiding the lymph down, And once you're done with this side of the face, you are going to do the exact same thing on the other side of the face, mirroring the exact same technique we did earlier.